Question 1. What is the nurse's priority action when a newly admitted patient is suspected of having active tuberculosis? A. Notify the hospital administrator. B. Place the patient in airborne isolation. C. Administer a Mantoux skin test. D. Start oxygen via nasal cannula. Answer. B. Place the patient in airborne isolation. Question 2. Which task is appropriate to delegate to a UAP for a patient on airborne precautions with tuberculosis? A. Monitor the patient's respiratory rate. B. Collect sputum specimens for culture. C. Assist the patient with morning hygiene. D. Teach the patient about isoniazid therapy. Answer. C. Assist the patient with morning hygiene. Question 3. A patient diagnosed with TB asks when they will no longer be contagious. What is the nurse's best response? A. You will not be contagious after 24 hours of antibiotics. B. You'll be cleared once your fever goes down. C. You are not contagious unless you have symptoms. D. You are generally not contagious after 2 to 3 weeks of proper treatment. Answer. D. You are generally not contagious after 2 to 3 weeks of proper treatment. Question 4. Which patient requires the most immediate intervention by the nurse? A. A patient with latent TB complaining of fatigue. B. A patient with TB and hemoptysis. C. A patient starting rifampin who reports orange urine. D. A TB patient refusing their evening medication dose. Answer. B. A patient with TB and hemoptysis. Question 5. What should the nurse do first if a TB patient scheduled for discharge reports not having a place to live? A. Proceed with discharge and document the concern. B. Contact the social worker immediately. C. Provide a list of local shelters. D. Notify the infection control team. Answer. B. Contact the social worker immediately. Question 6. A nurse is caring for a patient on RIPE therapy. Which lab value requires the most immediate follow-up? A. ALT85U/L. B. Hemoglobin 13G/DL. C. Platelets 180,000/mm superscript 3. D. Sodium 138 milliequivalent/L. Answer. A. ALT85U/L. Question 7. A TB patient receiving pyrazinamide reports severe joint pain. What is the nurse's priority action? A. Encourage warm compresses. B. Document the complaint and continue monitoring. C. Notify the provider of potential medication side effects. D. Reassure the patient this is expected. Answer. C. Notify the provider of potential medication side effects. Question 8. Which action by a new nurse caring for a TB patient requires intervention by the charge nurse? A. Wearing an N95 mask when entering the room. B. Disposing of PPE before exiting the room. C. Placing the patient in a negative pressure room. D. Wearing only gloves and a gown when suctioning the patient. Answer. D. Wearing only gloves and a gown when suctioning the patient. Question 9. Which symptom in a TB patient indicates possible liver toxicity from medications? A. Nausea and vomiting. B. Dizziness when standing. C. Light-colored stools and dark urine. D. Increased appetite. Answer. C. Light-colored stools and dark urine. Question 10. What is the priority teaching point when starting a patient on rifampin therapy? A. Take it with food to minimize stomach upset. B. Use backup contraception due to reduced pill effectiveness. C. Avoid sunlight exposure while on this drug. D. Stop taking the drug if your urine turns orange. Answer. B. Use backup contraception due to reduced pill effectiveness. Question 11. Which patient is at highest risk for developing active TB after exposure? A. A 26-year-old with no symptoms. B. A 72-year-old with COPD and diabetes. C. A 42-year-old who received the BCG vaccine. D. A 30-year-old with a negative TB skin test. Answer. B. A 72-year-old with COPD and diabetes. Question 12. Which PPE should the nurse use when suctioning a TB patient? A. Gown and gloves. B. Gloves and surgical mask. C. Gown, gloves, and N95 mask. D. Face shield and surgical cap. Answer. C. Gown, gloves, and N95 mask. Question 13. A patient exposed to TB is asymptomatic. What is the next best action by the nurse? A. Begin 4-drug treatment. B. Perform chest X-ray and TB skin test. C. Administer oxygen. D. Place patient in contact isolation. Answer. B. Perform chest X-ray and TB skin test. Question 14. A patient with TB refuses to wear a surgical mask while being transported. What should the nurse do? A. Cancel the transport. B. Proceed with transport and use extra PPE. C. Call security to force compliance. D. Educate the patient on transmission risks. Answer. D. Educate the patient on transmission risks. Question 15. The most reliable diagnostic test to confirm active TB is A. Chest X-ray. B. Tuberculin skin test. C. Sputum culture for acid-fast bacilli. D. Serum TB antibody test. Answer. C. Sputum culture for acid-fast bacilli. Question 16. A nurse is reviewing discharge instructions for a patient with TB. Which statement needs correction? A. I will take all my medications for the full duration. B. I can stop medications once I feel better. C. I will cover my mouth when coughing or sneezing. D. I will follow up regularly for lab work. Answer. B. I can stop medications once I feel better. Question 17. What is the purpose of DOT, directly observed therapy, in TB treatment? A. Ensure medication cost is covered. B. Prevent the spread of TB to family. C. Ensure adherence and completion of therapy. D. Monitor side effects of medication. Answer. C. Ensure adherence and completion of therapy. Question 18. The nurse suspects a TB medication is causing peripheral neuropathy. Which drug is most likely responsible? A. Rifampin. B. Isoniazid. C. Pyrazinamide. D. Ethambutol. Answer. B. Isoniazid. Question 19. What should the nurse emphasize when educating a patient with latent TB infection? A. You are not contagious, but still need medication. B. You must stay in isolation for 6 months. C. You will need to notify the CDC. D. You are likely to develop active TB soon. Answer. A. You are not contagious, but still need medication. Question 20. Which behavior by a nurse caring for a TB patient shows appropriate infection control? A. Wearing a surgical mask in the room. B. Using hand sanitizer after leaving the room. C. Removing gloves after exiting the room. D. Wearing an N95 respirator upon room entry. Answer. D. Wearing an N95 respirator upon room entry. Question 21. What is the nurse's best response when a patient on TB medication reports vision changes? A. Reassure the patient this is temporary. B. Encourage the patient to increase fluid intake. C. Withhold ethambutol and notify the provider. D. Document and monitor for 24 hours. Answer. C. Withhold ethambutol and notify the provider. Question 22. Which finding requires immediate action in a TB patient receiving rifampin? A. Orange-colored urine. B. Mild fatigue and loss of appetite. C. Yellowing of the skin and scara. D. Occasional night sweats. Answer: C. Yellowing of the skin and scara. Question 23. A TB patient in isolation asks to walk outside. What is the nurse's most appropriate response? A. You must remain in your room at all times. B. You may go outside without your mask if no one is around. C. You may go outside only while wearing an N95 respirator. D. You may leave the room with a surgical mask and staff escort. Answer: D. You may leave the room with a surgical mask and staff escort. Question 24. Which TB patient is the best candidate for home care with public health follow-up? A. An elderly patient with dementia. B. A stable adult patient adherent to treatment. C. A patient with uncontrolled hallucinations. D. A non-English speaker with no family support. Answer: B. A stable adult patient adherent to treatment. Question 25. What is the priority nursing action after a nurse experiences a needle stick from a TB-positive patient? A. Start prophylactic TB treatment immediately. B. Report the incident and follow up with employee health. C. Begin airborne precautions immediately. D. Wash the site and return to work. Answer: B. Report the incident and follow up with employee health. Question 26. Which of the following patients should the nurse assess first? A. A TB patient reporting burning with urination. B. A TB patient complaining of numbness in feet. C. A TB patient with a sudden drop in oxygen saturation. D. A TB patient requesting pain medication. Answer: C. A TB patient with a sudden drop in oxygen saturation. Question 27. A nurse is teaching about airborne precautions. Which statement by a student nurse indicates correct understanding? A. I will wear a surgical mask when entering the room. B. I will place the patient in a negative pressure room. C. I will use a face shield only during suctioning. D. Gowns are not needed for airborne precautions. Answer: B. I will place the patient in a negative pressure room. Question 28. A TB patient expresses noncompliance with medications due to financial issues. What should the nurse do first? A. Document the patient's financial barriers. B. Notify the provider for cheaper options. C. Refer the patient to a case manager or social worker. D. Encourage the patient to borrow money. Answer: C. Refer the patient to a case manager or social worker. Question 29. Which nursing action best helps prevent TB transmission in the community? A. Educating TB patients about public coughing etiquette. B. Encouraging yearly chest x-rays. C. Promoting antibiotic use for all respiratory illnesses. D. Recommending surgical masks for all patients. Answer: A. Educating TB patients about public coughing etiquette. Question 30. The most effective way to confirm a patient with suspected latent TB is A. A chest x-ray. B. A positive sputum smear. C. A positive tuberculin skin test and no symptoms. D. A WBC count over 12,000. Answer: C. A positive tuberculin skin test and no symptoms. Question 31. A nurse is giving discharge instructions to a TB patient. Which statement by the patient indicates understanding? A. I'll stop taking my medications if I feel better. B. I must wear an N95 mask at home. C. I'll keep my follow-up appointments for sputum checks. D. I don't need to cover my mouth when coughing at home. Answer: C. I'll keep my follow-up appointments for sputum checks. Question 32. When is a TB patient typically cleared to return to work or school? A. After a negative TB skin test. B. After 3 consecutive negative sputum cultures. C. After symptoms resolve. D. After completing all 6 months of therapy. Answer: B. After 3 consecutive negative sputum cultures. Question 33. A nurse overhears a UAP discussing a TB patient's diagnosis in the hallway. What should the nurse do? A. Report the UAP to the nurse manager immediately. B. Remind the UAP about patient confidentiality. C. Ignore the situation unless it happens again. D. Ask the UAP to explain the patient's condition. Answer: B. Remind the UAP about patient confidentiality. Question 34. Which teaching is most important for a patient prescribed isoniazid? A. Avoid green leafy vegetables. B. Take with antacids to reduce GI upset. C. Report numbness or tingling in extremities. D. Expect blue-green urine as a side effect. Answer: C. Report numbness or tingling in extremities. Question 35. Which medication should the nurse question for a patient taking rifampin? A. Oral contraceptives. B. Acetaminophen. C. Multivitamins. D. Albuterol. Answer: A. Oral contraceptives. Question 36. A TB patient refuses isolation precautions. What is the nurse's best response? A. Respect the patient's right to refuse. B. Educate the patient on the importance of precautions. C. Notify the family and involve them in decision-making. D. Discontinue isolation and document the refusal. Answer: B. Educate the patient on the importance of precautions. Question 37. Which lab result indicates a serious complication of TB treatment? A. AST45U/L. B. WBC6-000/MM superscript 3. C. Platelet 60-000/MM superscript 3. D. Hematocrit 42%. Answer: C. Platelet 60-000/MM superscript 3. Question 38. Which task is appropriate to delegate to a licensed practical nurse, LPN? A. Teaching a patient how to use a home nebulizer. B. Evaluating a TB patient's response to therapy. C. Administering isoniazid and documenting the dose. D. Developing a discharge plan for a TB patient. Answer: C. Administering isoniazid and documenting the dose. Question 39. A TB patient is on airborne isolation and now reports increased anxiety. What should the nurse do first? A. Call the provider for a sedative order. B. Tell the patient to relax and stay calm. C. Ask what is causing their anxiety. D. Immediately discontinue isolation. Answer: C. Ask what is causing their anxiety. Question 40. Which infection control practice is essential when transporting a TB patient within the hospital? A. Ensure the nurse wears an N95 mask. B. Keep the patient in full PPE during transport. C. Have the patient wear a surgical mask. D. Use a wheelchair with a disposable sheet. Answer: C. Have the patient wear a surgical mask. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.